several factors, often related to lifestyle, diet, or health conditions. 1. Dehydration. Lack of adequate water intake can make semen thicker and stickier, as the body reduces water content in bodily fluids. This can also concentrate compounds that contribute to odor. 2. Diet. Certain foods can affect the smell and consistency of semen. High consumption of garlic, onions, red meat, asparagus, or caffeine can lead to a stronger or unpleasant odor. Conversely, fruits like pineapple may make it smell sweeter. 3. Infections. Sexually transmitted infections, STIs. Conditions like chlamydia, gonorrhea, or trichomoniasis can cause changes in the smell and appearance of semen. Prostatitis. Inflammation of the prostate gland can lead to smelly, sticky semen, along with symptoms like pelvic pain or painful urination. Urinary tract infections, UTIs. These can also affect the smell and quality of semen. 4. Hormonal imbalance. Hormones play a role in the production of semen. Any imbalance, such as in testosterone levels, can affect the composition, smell, and viscosity of semen. 5. Frequent ejaculation or long periods without ejaculation. Semen that is stored in the body for longer periods may become thicker and more concentrated, leading to changes in consistency and smell. 6. Poor hygiene. Lack of proper genital hygiene can contribute to bacterial growth, which might lead to an unpleasant odor in the semen. 7. Medications or supplements. Certain medications, e.g. antibiotics, or supplements, e.g. protein powders or multivitamins, can alter the smell and consistency. 8. Medical conditions. Diabetes can cause changes in the smell due to high blood sugar levels. Liver or kidney disease. These conditions can alter body fluids and may contribute to unusual odors. If the issue persists, it's wise to consult a healthcare provider to rule out infections or other underlying health problems. Frequent ejaculation itself does not necessarily indicate a weaker prostate or other organs. However, if semen consistently appears thicker, stickier, or has an unusual smell after frequent ejaculation, it could suggest that the body is not replenishing the seminal fluid as quickly. Here's why this can happen. 1. Semen composition and replenishment. Semen is made up of fluids from the prostate, seminal vesicles, and other glands. When ejaculation occurs frequently, the body may not have enough time to fully replenish the components, leading to thicker or stickier semen. This doesn't imply weakness, but rather reflects the natural process of fluid production and storage. 2. Fluid concentration. With frequent ejaculation, the seminal vesicles and prostate may produce less fluid each time, concentrating the remaining fluid and making it appear thicker or stickier. The odor might also be stronger because it becomes more concentrated. This is a normal response to frequent release. 3. Prostate and seminal vesicle function. While frequent ejaculation doesn't directly indicate prostate weakness, it could reflect an underlying issue if there are persistent changes in semen quality along with other symptoms, e.g. pain, frequent urination, or discomfort. Conditions like prostatitis or low-grade inflammation could impact fluid production. 4. Age-related changes. As men age, the prostate and other reproductive glands naturally produce fluid at a slower rate. This could mean that frequent ejaculation might more noticeably affect semen quality in older men compared to younger men. 5. General health and nutrition. Poor nutrition, dehydration, or other health issues could contribute to the body's slower ability to replenish seminal fluids. This would be more indicative of overall health rather than just prostate or glandular function. 6. Hormonal factors. Hormones like testosterone play a role in semen production. If hormonal levels are suboptimal, it might affect the quantity and quality of semen. In conclusion, while frequent ejaculation can make semen thicker or stickier, it doesn't directly imply a weaker prostate. If other symptoms or persistent changes accompany it, seeking medical advice would be a good step to rule out any potential issues. There are several home remedies and lifestyle changes that may help support prostate health. These methods can be beneficial for conditions like benign prostatic hyperplasia, BPH, prostatitis, or general prostate wellness. Here are some home remedies and practices to consider. #1. Dietary changes. Rich in lycopene, which has antioxidant properties that may help support prostate health. Pumpkin seeds, high in zinc, which is important for prostate function. They also contain phytosterols, which may help reduce symptoms of BPH. Green tea contains antioxidants like catechins, which may help reduce inflammation and support prostate health. Cruciferous vegetables. Vegetables like broccoli, cauliflower, and Brussels sprouts contain sulforaphane, a compound that may reduce the risk of prostate problems. Fish. Omega-3 fatty acids found in fish like salmon or mackerel can help reduce inflammation. 2. Herbal supplements. Saw palmetto, a commonly used herb that may help alleviate symptoms of BPH, such as frequent urination. Pygeum, derived from the bark of the African plum tree, this supplement has anti-inflammatory properties that can benefit the prostate. Stinging nettle, often used in combination with saw palmetto, it may help reduce the symptoms of BPH. Ryegrass pollen extract. Some studies suggest it may improve symptoms of prostatitis and BPH. 3. Hydration. Drink plenty of water to help flush out toxins from the body and reduce the risk of urinary tract infections, which can exacerbate prostate problems. Avoid excessive caffeine and alcohol, as they can irritate the bladder and increase symptoms like frequent urination. 4. Regular exercise. Pelvic floor exercises. Strengthening the pelvic floor muscles can improve bladder control and reduce urinary symptoms associated with prostate issues. Aerobic exercises. Activities like walking, jogging, or swimming can improve blood flow and reduce inflammation. Strength training helps maintain overall body health and hormone balance, which may indirectly benefit the prostate. 5. Maintain a healthy weight. Obesity is linked to an increased risk of prostate problems. Eating a balanced diet and engaging in regular exercise can help maintain a healthy weight. 6. Reduce stress. Stress can exacerbate symptoms of prostatitis and other prostate conditions. Practices such as meditation, yoga, or deep breathing exercises may help alleviate stress. 7. Warm baths. Taking warm baths, sitz baths, can help reduce discomfort associated with prostatitis by relaxing the pelvic muscles and improving blood circulation. 8. Avoid sitting for long periods. Prolonged sitting can increase pressure on the prostate. Taking breaks to walk around or use a cushion may help relieve this pressure. Potential risks and considerations. Consult with a healthcare provider. If you have persistent symptoms, it's important to see a doctor, as prostate issues can sometimes indicate more serious conditions. Herbal interactions. Some supplements may interact with medications, so check with a healthcare professional before starting any new herbal remedies. Monitoring symptoms. Home remedies can complement medical treatment, but should not replace it if the symptoms worsen or do not improve. These remedies can be a helpful part of managing prostate health, but if symptoms persist or are severe, it is important to seek medical advice. Prostate issues can indeed affect sexual function, potentially impacting stamina and performance in bed, but the relationship is indirect. Here's how prostate problems and their relationship with the kidneys could influence sexual health. 1. Impact of prostate issues on sexual performance. Erectile dysfunction conditions like benign prostatic hyperplasia, BPH, or prostatitis can contribute to erectile dysfunction due to inflammation, pain, or discomfort in the pelvic region. In some cases, treatments for prostate issues, such as certain medications or surgeries, can also contribute to ED. Reduced ejaculation or painful ejaculation. Prostatitis, in particular, can cause pain during ejaculation or reduce the amount of ejaculate, leading to discomfort and impacting sexual satisfaction. Libido reduction. Chronic pain and inflammation associated with prostate issues can lower libido and make it more challenging to maintain sexual stamina. Premature ejaculation. Some men with prostate issues experience premature ejaculation due to hypersensitivity in the pelvic area, though this is less common than ED. Number 2. Relationship between the prostate and kidneys. The prostate and kidneys are part of the urinary system, but they serve different functions. Prostate function. The prostate produces seminal fluid, which helps transport sperm during ejaculation. It also surrounds the urethra, the tube through which urine passes. Kidney function. The kidneys filter waste and excess fluids from the blood to produce urine. Enlarged prostate and urinary issues. When the prostate is enlarged, as in BPH, it can press on the urethra, causing difficulty in urinating. This can lead to urine retention, which, over time, may strain the kidneys or increase the risk of urinary tract infections, UTIs, that could eventually affect kidney health. Prostatitis and UTIs. Infections in the prostate can lead to recurrent UTIs, which might spread to the kidneys if not treated, potentially causing kidney infections. Hammer 3. How kidney issues could relate to sexual performance. Kidney disease. Chronic kidney disease can cause hormonal imbalances, particularly in testosterone levels, which can contribute to reduced libido and erectile dysfunction. Impact on blood circulation. Since the kidneys regulate blood pressure and volume, kidney issues can affect the circulation needed for erectile function. Medication side effects. Certain drugs used to treat kidney conditions may also impact sexual function. Have 4. Common symptoms indicating both prostate and kidney issues. Frequent urination, especially at night. Difficulty starting urination or weak urine flow. Pain in the lower back, pelvis, or groin. Blood in the urine could indicate infection or other conditions. Conclusion. While prostate issues are more directly associated with sexual performance problems, there can be a relationship with kidney health, especially if urinary symptoms are severe or recurrent. Managing prostate conditions with the help of a healthcare provider can improve both urinary function and sexual health, potentially reducing strain on the kidneys.